The NCSBN Clinical Judgment Measurement Model is the absolute foundation of the next-generation NCLEX, and you must understand how to apply it. It begins with recognizing cues. This is the detective work of patient care. The exam will present you with a clinical scenario overflowing with information in a patient's chart, lab results, and nurse's notes. Your task is to identify what is relevant and what is just noise. For instance, in a client with heart failure, a 3-pound weight gain in 24 hours, crackles in the lungs, and a potassium level of 3.1 are critical cues. The exam will try to trick you by including distractors like a normal temperature or a note about a family visit. You have to laser focus on the significant data points that signal a problem. Next, you analyze these cues. This means connecting the dots to understand what the cues mean together. It's the so what phase. The weight gain, lung sounds, and low potassium aren't separate issues. They collectively point to worsening heart failure and a dangerous electrolyte imbalance from diuretic use. On the exam, you might see a question asking, what do these findings most likely indicate? This tests your ability to synthesize the data into a coherent clinical picture, moving from simple recognition to true analysis. From your analysis, you prioritize hypotheses. This is where you determine the most immediate threat to the patient. For our heart failure client, you might form several hypotheses: fluid volume overload, impaired gas exchange, and risk for cardiac dysrhythmias due to hypokalemia. An exam trap is to present multiple correct hypotheses, but only one is the absolute priority. The most urgent problem here is the risk for life-threatening dysrhythmias from the low potassium, which takes precedence over the fluid overload, even though both are related. Once you have your priority, you generate solutions. Think of this as brainstorming all possible interventions. For this patient, solutions could include administering a loop diuretic, providing supplemental oxygen, and giving IV potassium chloride. The NCLEX loves to use select all that apply questions for this cognitive skill, requiring you to identify all appropriate actions for the clinical situation. Then comes the most critical step for priority questions: taking action. Out of all the solutions you just generated, you must select the single most important action to perform first. While administering oxygen is important, the most critical immediate action is to address the dangerous potassium level by preparing to administer IV potassium as prescribed. The exam will test your ability to distinguish between what is important and what is immediately life-saving. Finally, you evaluate outcomes. This is the feedback loop where you check if your intervention worked. After administering the potassium, you would recheck the lab value and monitor the cardiac rhythm. The exam will present you with new data, like an updated EKG strip or a new potassium level, and ask you to determine if the client is improving, declining, or showing no change. To remember these 6 steps in order, use the mnemonic, really awesome pilots go to Europe. Really, recognize cues. Awesome, analyze cues. Pilots, prioritize hypotheses. Go, generate solutions. 2, take action. Europe, evaluate outcomes. Mastering this sequence is key to thinking like the NCLEX and ensuring safe, effective nursing practice.